Good evening. Welcome to the Spiritual But Not Religious Show. I'm your host, George Lewis. We've got a great show lined up, and actually we've been working through Mercury and retrograde all day, and I'll tell you what, it has been on top of our head. I've had two brand new computers that decided to not cooperate today, so we're using one of our old backup computers, and hopefully we're going to be able to give you the kind of quality that we would like to. I think that even if the quality's not great, my guest tonight will help make up for that. He does some really interesting kind of work. I want to tell you a little bit about next week's guest, my next week's guest is closely connected with Dr. Chikly. We have Dr. Bruno Chikly on this evening, and it's his wife, Alea Chikly, who's going to be on. Alea, after spending many years in Asia and in some of the very exotic kinds of spiritual sites, monasteries, and so forth, has developed a regression kind of therapy that's very, very unique, different from anything that I had ever seen or experienced. And my experience with it was absolutely positive. I was gifted a workshop with her at they were in the mountains up in Georgia, right at the base of the Appalachian Trail, and I was right at the tail end of cancer treatment for radiation and chemotherapy, and I was just finished up with surgery, or headed into surgery, and I had a weekend, a 3-day retreat up there with heart-centered therapy, and it just was wonderful, positive experience. Some really good friends had gifted me that weekend, and so I met Bruno and Alea then, and I think it was the spring of 2006 is when that happened. Let me tell you a bit about, before I talk about Bruno this evening, I want to talk a little bit about the Spiritual Broadcasting Network in this show, Spiritual But Not Religious. They're very much interconnected. I am convinced that there is a spiritual transformation in process that has been going on for a long time, but there's a quickening. It's starting to really happen very quickly, and we're participating in that. You know, there are really, I think at this point, millions of people who call themselves spiritual but not religious, who are either non-denominational or, like taking pieces of this belief and that belief, and they found their own kind of inner belief, very much God-centered kind of thing, God by whatever name they call it. But yet we don't have that community. We have all these diverse voices that, basically are very closely related in what we're looking for as an end result, and that's a transformation into the love vibration as opposed to the dark vibration that the world has been in all this time. And so the Spiritual Broadcasting Network will be bringing you those many diverse voices. And if I can get Tom to shut off the overhead light, we'll be much better, and we'll be ready to go. Yeah, it's on that back wall there, Tom. And when Tom gets back, we'll get Dr. Chikly online. He is the author of a book called Silent Waves. It's a theory and practice of lymph drainage therapy. That book is carried by the University Medical Library at Stanford, and the reviews on it are really fantastic. You're probably familiar with Dr. Bernie Siegel, who wrote, he's a best-selling author of Love, Medicine, and Miracles, and Peace, Love, and Healing, and How to Live Between Office Visits. And he says that this book is an incredible resource for patients, their caregivers, and health professionals. The extent of the information you make available to therapists and physicians is a gift we can all utilize in our practice and in our healing. So, Tom, if Tom's got Dr. Chikly on the line, we will chat. Bruno, have I got you there? Are you able to hear me? Bruno?
Hello?
Are you there?
Yes.
Good. And you know what? You're coming through wonderfully. We have good audio,
Perfect.
And Tom's getting me to move over so that your video is available and we can see it. It's actually, after all that's gone on today, we're really looking pretty good here.
Congratulations.
Yeah,
You're an offer.
I'm glad you're here. I'm really looking forward to our conversation. We started this what was it, a month ago or something, and we just had really difficult times, but somehow or other we weathered all that. You know, in the scheme of things, that kind of trouble isn't much, is it?
No, I mean, I have no problem. It just went at the right time. We're already very tired. We were going for Europe the next day. Don't worry. It was just the way it's supposed to be.
It worked out the way it was supposed to then.
Yeah.
So you actually not only have you written a book, but you've got an institute that. How long's your institute been? How long have you had that established?
We started almost 6 months ago. Believe it or not, it's very recent. But we taught the same kind of classes for 16 years now, about.
Right. You were with another institute at that.
Right, and we had about almost 8,000 to 10,000 students. It was a huge work we developed, and we're really happy we could help expand, give better health to North America and some classes in Europe.
Tom, we're getting just a little. Tom's gonna straighten out. We got a little kind of echo or whatever going on. So, with your institute, what do you actually do there? Is the institute really for just professionals, or is it for lay people? What?
Well, it's for anyone who could do manual therapy. And so we have a lot of PT, OT, osteopaths, a lot of manual massage therapists, and nurses and acupuncturists, physicians, everybody who are interested to touch life with their hands and improve someone else's condition in a safe and non-invasive manner.
So you have a pretty nice acronym for it's the Chikly Health Institute, or CHI. That's very, very, very apropos. So, but what's different about your curriculum? What sets you apart from the other manual work?
Well, we are all building on the shoulders of the people before us. I'm just very creative, and I have a lot of education, and I have ability to go from the left brain to the right brain. So I am an MD, an osteopath. I have 3 doctorate, and I also very intuitive, and I'm able to talk with my hands to the tissues and find the best way to resolve some challenge in the body, what they need to find some kind of healing. And so what we do is we develop, first of all, the lymph, and that was the first time, I think, in the world when we could work very specifically with the lymph rhythm and the lymph direction. So everybody came, because everybody was doing a lot of very basic lymphatic drainage or lymphatic techniques. They were like, a lot of people they said they were milking like a cow. They were just pumping all day long with no feedback. And when I introduced the way we can really feel the wave of the lymph, and just like surf on the waves, you can just go and feel the waves and go with it and check its rhythm, its direction, its quality, its depth. And then you begin to really have a discussion and interaction of feedback from the body, and you can just be a partner. You can now participate in the process of life and feel if what you're doing is okay, if you are going in the right direction or wrong, and etc. Yeah.
Well, you know what I think what we probably should do, Bruno, is I'm sure we have many viewers who really don't understand what we're, like what the lymph system is, what we're talking about at all. Can you give a layman's definition of what the purpose of the work is? What are we really trying to accomplish, and kind of generally how we approach that?
All right. So the bigger picture here is manual therapy. So I'm going to go from very wide to very small. Manual therapy is we have a pioneer in America, which is A.T. Steele, the father of osteopathy. And the father of osteopathy basically influenced the manual therapy from PT, OT, from chiropractor, from Rolfing, all that, fascia therapy, all those are branches from the idea that there is some mechanism in the body to heal. There is sometimes it used to call the inner pharmacy of the body. We can release something and let the body heal itself with its own intrinsic forces. And then what we do now, we have to find what part of the body is off. And we have to know if it's the bones, and then we can work with the joint, the articulation,
right,
or inside the bones itself, or it's the arteries, the veins, if it could be the fascia, the muscles, and sometimes it's a lymph system. So the lymph system, and the other curriculum, by the way, is the brain. We'll talk about the brain after that. But the lymph system is the first one I introduced in the States. It was not that known. I think I wrote the very first book in North America. And
well, you had your education, I believe, in French University, and you got some kind of an honorable award or medal, or I don't recall.
Yeah, I did my. I was interested in manual therapy since the age of 12. And
really?
I did my medical thesis on the lymphatic system, and I got an award from the University of Paris with this thesis. And then there was a base for my book. The book is about 450 pages, and it was the first book in North America to really have an extensive discussion about the lymph system. And it's funny, you have to wait for a French guy to come and write a book about that. But everybody's talking about the lymph system for 20, 30 years, but nobody really put together and tried to understand. So when you ask a question about the lymph system, most physicians in the States, most PT, have a very basic education, and most, it's not very spread out, the exact function of the lymph system. So if you want, it's a second circulation. If you want, it's a parallel to the veins. It brings things from the tissue back to the heart. It brings toxins, heavy metals. In the lymph system, you don't have much oxygen, but you bring back something from the tissue to the heart. The question is, why do we need two pathways?
Right.
Why do we need the veins to bring back things from the tissue and the lymphatics? And it's they have two different functions. The veins are very fast and very efficient and bring a lot of things back to the heart. But if something is a little far inside the tissue, a little bit away from a vein, blood capillary, if something is stuck in the tissue, and especially if it's a thick, if there's a mucus or there's inflammation, it's much harder to bring that through the vein. The vein is very fluid.
Right.
The lymph system is very slow, but it's like really taking the time to get rid of something that's very sticky, very rubbery in the tissue. You have that if you have when you have a cold, you have mucus in your nose. You have the same thing in chronic fatigue syndrome, fibromyalgia. You will have something in your small intestine with digestion problem, with leaky gut syndrome. All those are very sticky fluid in the body, and the veins are moving something very fluid. It's very hard to move that out of the tissue. So the lymphatic system has intrinsic muscles, motoricity, so pacemaker cells that contract and create what we call the peristalsis and movement that actively is going to take things from the tissue and move it out of the tissue compartment, extracellular fluid. And